Hey, good morning, everyone. And my name is Ray, and today I will be presenting on voluntary assisted dying or VAD and the ethic and the clinical challenges it raises for nurses in palliative care. So the topic is voluntary assisted dying, ethical and clinical implications for nurses. So let's go. We exploring the four principles and the realities of the nurses practice. So the first part is introduction, the voluntary assisted dying. So we will be begin to defining VAD, then explore the four ethic principles that guide end of life care. I will present both supporting and opposing views of VAD. Before discussing how it affects nursing practice, especially in advanced care planning. So we go to see what is a voluntary assisted dying. So this allows eligible individuals to request medical help to end their life legally. It's not the same as suicide. It's tightly regulated. Patients must have an advanced illness expected to cause death within 6 to 12 months and be experiencing suffering that cannot be relieved in a way they find accessible. And then we will see why is VAD considered necessary. So then we will see why the VAD considered necessary. For many terminally ill patients, especially those in late stage cancer or neurodegenerative disease, current medical treatments may not always relieve pain, loss of dignity, or fear of prolonged suffering. VAD offers a compassionate choice, a way for patients to regain control over how they die rather than having their final days defined by unreliable suffering. It acknowledges autonomy, dignity, and personal value at the end of the life. Then we go into the next one, the four ethic principles in palliative care. The first one is autonomy. It means respecting and the patient's right to choice. And the next one is beneficence. It's acting in patient's best interest. Then is no malfections. It means avoiding harm. And is justice. It means fair and equal treatment for all. Then we will to say about the supporting VAD based on ethic principles. Supporters argue that terminally ill patients should have the right to decide how and when they die. Supporting VAD aligns with their four ethic principles. Autonomy allows terminally ill patients to choose when and how they die. Beneficence supports relieving suffering when no cure is possible. When treatment can no longer offer a cure. VAD may be viewed as an act of compassion that prioritizes relief from suffering. No malfeasance means avoiding harm. Prolonging life with severe pain may be more harmful than allowing death. Public support is strong, with approved in Australia rising from 11% in 1996 to 85% in 27, showing growing acceptance of VAD as a compassionality choice. So we go into the next one to together see the opposing VAD based on the ethic principles. Oppositions to VAD also draws on the four ethic principles. Autonomy isn't absolute. Some critics point out that patients who are severely ill or mentally distressed may not be in the right state to make such a life-ending decisions. Their ability to exercise full autonomy can be compromised by decisions, cognitive decline, or external pressure. As Vaki notes, the principle of autonomy applies only when um, the person that is can do the right full capacity to make informed, rational decisions. Beneficence can mean offering palliative care rather than ending life. No malfeasance or do no harm warns that even well-intended death can violate medical ethics. Cultural and social concerns also affect the fairness and safety in VLD access. Critics worry VLD may risk ethical standards and harm vulnerable patients. And according to the Katchhofer and Louis emphasizes the cultural religious and the social context significantly influence public attitude and raise valid concern about fairness in VAD access and implementation. So we will see the practice challenge for nurses. The practice first, the emotional and the psychological burden is one of the most commonly reported issues. Nurses involved in VAD procedures often carry the ethical weight of participating in the patient planned death. As Shandham found, even experienced nurses continue to feel the emotional impact, and it doesn't not necessarily diminish with time. Secondly, many nurses, particularly those from culturally and linguistically diverse background, express uncertainty about their legal responsibility and personal values in relation to VAD. Malik noted that CALD, CALD nurses frequently report limited knowledge of VAD legislation and ethics and feel unprepared to respond to the patient request. Third, role ambiguity also contributes to professional stress. Nurses might find that the principles of palliative care focus on comfort and natural death appear in conflict with assisting in a medically planned death. This can lead to moral distress and questions around identity as a caregiver. In summary, nurses face a complex mix of emotional, cultural, ethic, and legal challenges when VAD becomes part of their practice. So the next one is ensuring patient safety and quality of care. To ensure the safety and quality of care in voluntary assisted dying, nurse preparedness essentially, both legally and emotionally. Studies show that clear policy framework and structure procedure give nurses confidence to participate safely in the VAD process. When protocols are well defined, nurses feel more protected and less emotionally overwhelmed. Education and training are equally vital. Malik finds that CALD nurses want target VAD training that includes legal and ethical responsibility, and cultural sensitivity, role clarity, and community skill for talking with patient and family. Moreover, ongoing emotional support is necessary. Reflecting sessions, ethical supervisions, and access to peer discussion can reduce burnout and build resilience. Then we will see practical strategies for nurses in VAD. Follow the structured procedures and legal protectors. The nursing feels safer and more confident when VAD is guided by standardized protocols and step-by-step procedures. And the VAD-specific communication training skill in sensitive conversations are essential when supporting patients and families through such a deeply emotional decisions. We will see also have the cultural competence. Nurses, especially indigenous and CALD staff, may face unique challenges. Strategies must include training in culturally appropriate care, particularly when working with patients who wish to die in place or maintain spiritual traditions. Those strategies not only protect nurses but also uphold the integrity and the compassion required in end-of-life care involving VAD. So conclusion, we can see in summary, voluntary assisted dying is a deeply complex and sensitive issue. It raises ethical questions about patient autonomy, relief from suffering, professional responsibility, and cultural values. For nurses, especially those from diverse backgrounds, VAD brings both emotional challenges and professional responsibility. With proper education, clear policies, and emotional support, nurses can help ensure that care remains safe, respectful, and patient-centered. Thank you. That's all.